My name is Dean Patterson, and I've experienced pain on and off for probably at least 20 years. I had my first back surgery in 1996, and that helped some. I was able to feel my right leg for the first time in probably 3 years. My foot didn't bother me anymore. So that was good, and so then I was going on after that first surgery for a little while, and I started getting some stabbing pain back where they put the hardware in. They grafted some bone in and put some hardware in there from rods and screws. So I was getting some pain there where I went to sit down at night, and I'd have to stand up and eat again at the counter. And so I went in for another evaluation. They told me that they need to go in and see what was going on. So I had another back surgery in 2000. And they went in, took the hardware out, and they said the bone fusion was fine, everything was good. But 2 weeks after I had the second surgery, I was in so much pain. I went back to the doctor, and he wanted to cut me in the front, make an incision in the front, and build a cage around my spine at that time. And I told him, I said, "Doc, you just cut me 2 weeks ago. You're scaring the living daylights out of me here." So I wouldn't do that surgery, so I let it go, and I was starting to get more and more pain, and I was getting to the point where I couldn't hardly walk. And so my wife was disabled at the time before she passed away, and so I didn't know what else to do. They put me on pain medication. I was on Vicodin and Chiropractic, muscle relaxers, or the combination, for probably at least 3 years. Then the pain was getting to the point where the Vicodin was not working, so then they put me on morphine, and I was on morphine almost 10 to 12 pills a day, of 30 milligrams. And I'm not a pill taker, so it was very hard for me to want to take all this medication. So then I kept going to my regular doctor, and he kept recommending this pain management. So I went to pain management and tried to deal with it through my head and tried to, suck it up, like some of the doctors would tell me, just suck it up, deal with it, or just take the day off from work when you're in so severe pain. But the thing is, I have to work. I had two families to support at the time, and I couldn't do that. Pain was getting so bad that I was basically on a cane, and then all of a sudden I was recommended by this one doctor in pain management to see about sending me down to Los Angeles to Sunset Kaiser and seeing if a Medtronics device stimulator put in my back would help. And so then in 2006 I went down, had the trial, the stimulator rods put in, and I wore the belt on the outside for a week. They said that looks like it was going to work. It helped send stimulation into the nerves, and it helped me deal with the pain a little better. So then I had the surgery in February of 2006 and had the Medtronics device installed into my back, in my lower buttock area, on the left side, and I had that in for almost 5 years. Then I was dating this lady at the beginning of 2010 here, and she recommended Dr. Scott. She said, if you're facing a third back surgery, why not see this chiropractor? I was very leery about seeing a chiropractor because I had seen a chiropractor years before I had even my first back surgery, and by the time I left the chiropractor's office, it was like I was in such severe pain. I said, why do I need to go through this when I'm already hurting so bad? But she gave me a free consultation, so I decided to come and check it out. What else did I have to lose? I was facing a third back surgery, and the Medtronics device wasn't 100% anyway, which I knew about. So I come to see Dr. Scott, and I've been seeing him since January of this year, 2010, and I think it was about March things started turning around for me, and I believe it was from January to March, I was still in some pain, but I believe it was about the 3rd or 4th week in March, I was able to actually turn my Medtronics device off. I was feeling so much better, I turned it off. And from that point on, I kept it off, and I only used it maybe 3 times, 4 times from the time from that point all the way up to just before I had the Medtronics taken out, and that was November 9th. I had the Medtronics removed because I'm feeling good, I can walk normal, I don't use a cane no more, I'm not hurting, I'm not on ice. I went from 12 to pills of morphine a day down to 2. My regular doctor will not take me off it completely yet, but I'm on 2 pills of morphine a day compared to almost a dozen. So I am doing fantastic. I went dancing Friday night with my new lady, and I'm enjoying this life. I didn't think life could get so good again, so I'm really enjoying life now. I'm having a ball. I'm not being in pain. I can sit at my desk and work all day without getting up and walking out on the warehouse floor for 10 or 15 minutes trying to get my mind off of the pain and trying to deal with things. And I just about went on disability. I believe it was in February or March of this year. I didn't want to go that route. So after I started seeing Dr. Scott, things started working. I thought, now I got a new life ahead of me.